Good evening, everyone. I am Dr. Sudipta Mitra. I'm a director at RMI Foundation and a consultant ophthalmologist with MRI Medical Center, Kolkata, and Silverline Eye Hospital, Kolkata. On the eve of World Sight Month, today I'm going to speak on a very relevant and important topic, preservation of eyesight. Now, why do we need to preserve our eyesight? Why is it so important? Because it is said that the eyes are the windows to the soul. 80% of our memories are determined by what we see. That beautiful picture there of Babu Ghat actually tells us about the time we spend there, the beautiful moments. So basically, it is a window to the world. It helps us to connect with others and gives us happiness. And sight is something which is physical. The signals that we pick up goes to our brain, and that is interpreted by our brain, and we get vision. So basically, we need to preserve our eyes because by our eyes, we pick up these signals and how we develop vision, which is stored in our memory. About World Sight Day, I would like to talk briefly. It is an annual global event which draws attention on blindness and vision impairment. The objective is to create awareness about eye care, vision blindness, and treatments involved in curing eye impairments. This day is mainly focused on drawing attention to the different causes that lead to blindness or visual impairment like cataract, glaucoma, refractive errors, etc. Today, I'll be briefly talking about some of them. And why did we have this World Sight Day? The reason is 2.2 billion people globally have unaddressed vision impairment or blindness. Amongst that, 1 billion people could have vision restoration if we could treat them. 2% in India India's population is also blind. Approximately 1.1 million people have cornea blindness in India, and the current annual transplant number is only 25,000, where we actually need 1 lakh. So we need to be more conscious. And now we have to understand the eye anatomy. It is very important. It's like a camera. You know, the lights that go in the eye, actually, it passes from this opening in the center, through the pupil, through the jelly behind it, and finally on the retina. So that is picked up by the optic nerve, it goes to the brain, and then we see. So knowing this, it is important for us to remember that each part of the eye has to be healthy to get good vision. Some of the common eye problems. Now, these are some of the eye problems that we face in our day-to-day life. A red eye, which may be a dry eye due to digital strain, due to conjunctivitis of any cause. So this is how a red eye might look like. This is how it looks like. And another important problem is refractive errors. A person who may not be seeing as much as he should or has distorted vision. Astigmatism, myopia, hyperopia. Another important problem is color blindness. This is how a red apple will look to a person who is color blind. So this is again a very important problem along with night blindness, which I will talk in the coming portion. Other eye problems, common eye problems that we see in children are lazy eye, amblyopia, I will talk about it, squint, and ptosis. This is a ptosis, this is a squint. And these are some of the eye problems in older people. A person who is above 40 has difficulty in near vision, presbyopia, a patient of cataract or glaucoma, and patient with retinopathy or corneal diseases. Myopia, as I talked, the refractive error, a person who can see things very well at near and difficulty in seeing for distance. The reason might be a long eyeball and the light does not focus behind. Remember the anatomy of the eye. So it does not focus behind properly. So the person cannot see properly. And this may be hereditary in nature or because of the length of the eyeball. It is usually seen between 8 to 12 years and it leads to squinting of the eye, squeezing of the eye to see the distant objects and leads to headache. Very well, it can be treated with spectacles. So it is very, very important to get an eye testing done and get corrected spectacles. Contact lenses are also an alternative. Over the age of 18 years, laser surgery could be an option. Similarly, another eye disease is hyperopia. Difficulty in seeing things for near here is due to a small eyeball. Myopia, you can't see for distance. Hyperopia, you can't see for near. In both these, there is difficulty and there is headache. As a person grows old, a similar type of feature develops, which is known as presbyopia over 35 years of age. Here, a person also cannot read for near. Or in hyperopia in younger people may be due to a shorter eyeball. Again, the corrective lenses can be given a plus power addition, which helps the light to focus properly on the retina and makes the person see. Of course, refractive surgeries can also be done, but your doctor is the best person to judge about it. This is how a hyperopic person looks. See, he can't see properly at near, but for distance, he sees very, very well. Astigmatism is a problem, and this is how a person with astigmatism would see a bridge. The vision is not very perfect, and it is a little distorted. This is probably due to the cornea. The cornea, which contributes a large part in the power of the eye, is not perfectly round and smooth. Due to this imperfection, there's astigmatism, and astigmatism may lead to lazy eye in children, squinting, distorted vision, difficulty in driving at night are some of the features of astigmatism. Again, wearing lenses, contact lenses or spectacles are a solution, and of course, refractive surgeries. Now, talking about children eye problems. Amblyopia, as I told you, amblyopia is a lazy eye. In early childhood, sometimes both eyes do not develop properly. So there is subnormal vision in any one eye. And in amblyopia, the brain focuses on one eye more than the other eye, and that becomes very lazy. And it is very difficult to pick up if the other eye has good vision, as there is no pathological condition, no obvious symptoms. Parents are simply in the dark. Only by cover test, by covering the good eye, we come to know this. So school screening, routine eye checkup before 5 years for children is extremely important. Now, why is it important? Let us leave the eye. No, we can't. We need both the eyes for binocularity, for depth perception, for seeing an image in 3 dimensions. So amblyopia treatment is absolutely important, and it is done either by prescriptions. It can be done by patching the good eye and asking the person to see with the lazy eye by more stimulation. And it can be easily detected as early as 2 years of age. Another problem which we used to neglect earlier days is cross eye, squint, tircha, arc, or tarachoke, as we call commonly. This is because of the misalignment, and one eye looks ahead, other eye looks haywire. This is due to the 6 muscles that act like a pulley and move the eye from one side to another. When both the eyes there is discrepancy, then there is squint, and it may be muscle dysfunction, farsightedness, trauma, or sometimes genetic. Again, the symptoms are blurry vision, the child cannot see properly, there are headaches, excessive squinting, the squint grows cross or divergent. In some cases, sufferers develop lazy eye as well. So again, the treatment is by stimulation, glasses, exercises, and very rarely even surgery. Again, the surgery part has to be decided by your doctor. Ptosis is another important congenital problem or traumatic problem, trauma in early stages of life, and there's a droopy eyelid. Mostly, this has a hereditary component or a traumatic component, but it has to be treated early. Otherwise, this eye will not develop good vision. So again, very early in life, it should be taken care of, a doctor should be seen, and treatment has to be done to restore good vision as well as good eyesight. Corneal ulcers are something which we have to be very careful about. This is how a big corneal ulcer would look like, a white spot on the cornea, very easily seen on mirror. Now, this can be due to infection, it can be due to trauma, or by any injury, by anything else. It is also known as keratitis. Sometimes it may lead to redness, feeling of grittiness in the eye, discharge, pain when looking at bright lights, swollen eyelids, and of course this white spot. Causes, as I said, may be viral, fungal, parasitic, bacterial, whatever. Treatment is extremely important because otherwise the main part of the eye is the cornea, the transparent cornea in front of. So if this gets destroyed, 40% of your vision gets destroyed. It is important to treat these factors very, very importantly. And depending on the cause, either antibiotics, viral, antifungal, etc. can be given. It might need to use these as often as even 1 hour or half hour. And your doctor will advise you definitely. Surgery sometimes, scraping sometimes, all this is decided in cases which are resilient and are not easily treated. Very late cases may even require cornea transplant. So we should always take this very, very seriously. This is something which we face very commonly, our red eye. The outer transparent layer of the eye gets congested, conjunctivitis, red eye with prominent vessels, and the white portion of the eye is red or pink. But let me tell you, this is not very dangerous. If it is simple conjunctivitis and it does not affect vision. So we have to remember, as soon as we treat them, it will ease up and everything will go. Only that it needs early treatment because some of them are contagious. And so to limit spread, we have to treat them early. Symptoms, as I said, redness, grittiness, discharge, sometimes lots of tearing from the eye is also there, which is very, very annoying, causes bacteria, allergy, virus, or sometimes because of a foreign body in the eye. And how can we prevent it? By practicing good hygiene. Frequently touching the eye is a very important cause of conjunctivitis. So we should not touch our eyes, even if we have to wash our eyes, wash our hands first and then touch our eyes with clean water. And always do not, it is better to avoid sharing things with others when we are taking care of our eyes. Treatment is always focused on the symptomatic relief. Lots and lots of artificial tears are given. And let us remember that tearing is not bad because tears are our natural protectors to prevent and wash off all the infection that is there in our eye. Warm compresses may help. Contact lens wearers have to be extremely careful of this red eye because it may herald very difficult to treat infection in the eye. No antibiotics are used in viral infections. And in this COVID era, it is extremely important to look into the associated symptoms, which may tell us that it may be COVID-19 conjunctivitis, because that has also been reported. This is a very common feature and the most common cause of treatable blindness. So a cataract is something like this, a white clouding in the central part of the eye. And seeing a cataract, whenever a patient has cataract, the vision becomes frosty or foggy, and this is how it looks like. This is how the vision gets blurred, and there may be halos around artificial lights, there is less vision at night, glare, faded view of the colors. The colors that we normally see may not look as deep as they used to look. The red may look a little less red, and frequent change of spectacle is an indication. Many of us do not understand how cataracts come in. And suddenly there are questions that I face that I did not realize when it was there. So these are the features when you can see that the vision is diminishing, the color vision is not as good as it was before, or when you have glare or there is a change of spectacles very frequently, you must think that there may be cataract. Cataracts do not have any other treatment except surgery. It is the final answer. Early stages, we go on giving as much correction as possible in spectacles. There is no specific cause, but of course, Some things increase the chances of cataract, like injury, obesity, hypertension, alcohol consumption, or hormone therapy. Even too much of exposure to ultraviolet light, smoking, etc. may lead to cataract, as well as poor nutrition can lead to early cataracts. This is a cataract surgery that I had. This is a cataract surgery, how we had done it. In a cataract surgery, usually it is the lens which is cloudy, and in these cases what happens is we do not take out the whole of the cataract. Rather, this is broken into pieces, and then when the pieces are there, it is eaten up and a IOL is put in place. So that is how the clouded lens is removed and a clear lens is inserted. We make a buttonhole opening, and this is how we break up the clouded lens inside the eye in small pieces, eat it up, and fill up the eye with a jelly-like substance to occupy that space, the viscoelastic that we are using. And this is what the IOL, that clear lens that we are inserting in the eye in the place of the clouded cataractous IOL. So that is how it gets replaced, and that is the end of this surgery. So this is cataract surgery, and this is how it is done. And the patient has been done under topical, no injections. Now, another very important cause is glaucoma or kala mutia. So this is how the things look when you have kala mutia initially. Well, this is normal. Slowly your vision becomes tubular, and the early stages are, although you can see some part of the periphery, late stages, it becomes absolutely tubular vision. Early diagnosis is very, very important to save this vision, and treatment continues in the rest of life. This is not curable, but it is treatable to preserve vision. Now, usually this is due to the buildup and intraocular pressure in the eye, and there is a difficulty in the drainage system, or there is excessive production of fluid inside the eye. The damage is irreversible. We have to remember this, and thus it is known as a silent thief of sight. Some of the predisposing factors are greater than 60 years, history of glaucoma in the family, medical conditions like diabetes, heart disease, high blood pressure, farsighted or nearsightedness, a high refractive error, which is very high, injury to the eye, and some medications like steroids. Glaucoma, these are some of the investigations your doctor might prescribe, like tonometry, gonioscopy, perimetry, CCT. So these are to find out what type of a glaucoma is there. This is a gonioscopy going on. This is a perimetry which is going on to find out the field of vision that is still preserved. And this is to measure the pressure of the eye. The treatment usually are eye drops. One after the other, we go on adding as the pressure needs to be controlled. And it can be even up to 4 oral medication, laser treatment, and finally surgeries. Different type of eye drops are prescribed. As I told you, it can go up to 4 times to control the amount of IOP that is damaging for the eye. Different laser surgeries like filtration surgery, laser therapy to open up the clogged spot, or to create another space where the drainage can be out or there by drainage tubes or MIGS. Age-related macular degeneration is extremely important with aging, and this is one of the 4th most common cause of blindness. People here have difficulty in recognizing faces, have distorted vision. There are visual hallucination as very, very common degeneration in old age. And this is how it may look, like a spot which comes in a clear vision. Treatment, again, first of all, the diagnosis part, many of you might have been advised OCT, optical coherence tomography, which is a scan 3D image of your retina, and fluorescent angiography, where a dye is used to find out the blood vessels. Finally, the treatment, there is no specific treatment. According to the stages, some injections may be given, and all this is on the discretion, on the discretion of your doctor, which stage your ARMD is, and sometimes it needs lifelong treatment. Diabetic retinopathy, sometimes many of us may experience some black spots moving in the eye. This is a very typical feature of floaters in a diabetic eye diseases, which damages the retina of the eye. So this condition is very important to be picked up, because when it is picked up in early stages, we can control it by controlling the diabetic process. But in the late stages, it is very, very difficult to control. And sometimes there's irreversible blindness. So as I said, there are floaters, there's fluctuating vision, dark or empty spaces, and it also depends on the duration of diabetes, how controlled it is, associated features of blood pressure or cholesterol. So it is important to have a very good diabetic control, regular checkup through your retina surgeon or comprehensive eye surgeon to control diabetic eye problems. Eye strain nowadays is a very important problem. It creates grittiness of the eyes, difficulty to do regular work. Nowadays, with a lot of multimedia use like mobiles, gaming, etc., and computer use, this has gone up very high. But let me tell you, it is not serious at all. If you can release the features which are leading to this strain, then we can restore good vision, not only keep the good vision, but also give them comfort. So it is important to reduce this eye strain, and it may lead to blurring of vision, stinging, extremely annoying grittiness in the eye, discomfort, sometimes even reeling of the eye, watering of the eyes. And these are the conditions where it increases more, and this is increased during the COVID-19 lockdown phase, where watching television has increased 6%, news watching in the TV has increased to 57%, social media 25%, and chatting 23%. And it impacts our day-to-day life in reading, in cleaning, in day-to-day household work, and even on work on multimedia. So what we should do, follow a rule of 20-20, 20 minutes of viewing, looking at 20 feet away, and then for 20 seconds, and then go back to your work. 25 inches distance, we should keep our mobile, lower the brightness so that too much of light doesn't go in, wash your eyes frequently, use artificial tears as much as possible, avoid too much of nighttime redoing of this to prevent blue light exposure, and then to turn off some or all of the overhead lights while working on desktop or laptop. Most importantly, you have to know this to protect your eyes, because until you practice this, then for long term, you will have a very bad symptom of computer vision syndrome, which is very irritating and annoying. So we need regular eye checkup, and in regular eye checkup, we usually do a visual refractive error testing, slit lamp examination. Many of you might have done. This is a retinal examination is going on, a screening for glaucoma for children 3 to 5 years, ideally for adults up to 10 years, up to 40 to 54 years, 2 to 4 years, from 55 to 64 years, 1 to 3 years, and after 65 every year. And for comorbidities, your doctor will advise how frequently you should see a eye doctor, maybe 3 months to 6 months. So these are extremely important to preserve our eyesight, preserve our eye, so that our vision is good and we can preserve it. So let us all pledge to donate our eyes and light up our lives. Lives not only ours, but all around us. Help the visual impaired to see the beauty of life. Not only preserve our vision, but vision of all around us. Thank you very much.
Hello, ma'am. Thank you. Thank you so much, ma'am. Yeah,
do you have
one
any
patient.
questions?
Yeah, ma'am. Ma'am, there are many questions.
Yeah.
Okay.
Yeah.
And many patients want to get an answer in Bengali language, ma'am. Okay.
Okay, no issues.
Yeah.
I'll talk in Bengali. Just tell me the questions, please.
Yeah. The question is from Swagata Mukherjee.
Okay.
Myopic problem in genetic problem. Myopic problem is genetic problem.
Myopia can, yes, I'll talk in English as well as Bengali. Myopia can be a genetic problem. Myopia genetic problem hote pare. In case of powers which are more than 4, 5, even when the powers are less or more than 5 or 10, it can be a genetic problem. Yes, it can be. So a person who's having myopia in the family, parents, if they have myopia, they should get a regular eye testing of their children. And if a brother or a sister has myopia, then the youngers or the elders need eye testing.
Thank you so much, ma'am. The next question from Asit Banerjee: is there any natural treatment of myopic conditions of elderly persons?
It depends on the condition, because myopia, if it is in an elderly person, myopia can also come due to cataract, because when the lens becomes thick, then the light converges in front. So automatically there is myopia. Myopia means that you can't see for distance, you can see for near. So when your lens becomes thick, the light converges very nearby. So again, that is myopia. So in that case, the myopia treatment has nothing to do with natural remedy or any other glasses or anything, only surgery can be done. So myopia in adults is not something which just comes in. There must be some pathological condition. Otherwise, usually myopia comes in from childhood and stops after a certain age of growth.
Yeah, thank you, ma'am. The
Please,
next
whoever
question.
wants it in a Bengali language. Okay, yeah, go on.
Yeah, thank you so much, ma'am. The next question from Amlesh Bhattacharya.
Yes.
Whether formation of cataract is a natural process, how it can be avoided or deferred by taking what precautions from childhood?
Very nice and very, very interesting question. Thank you, Mr. Amulish,
Amlesh, yeah.
for asking. Because many of us think that onychal cataract, many people don't have cataract. That's not true. Just like my hair is graying and yours too, similarly, cataract will happen. So there is no precaution that can be taken from childhood except normal precautions of normal growth, how your lens should not be injured, চোখে যাতে চোট না লাগে, ভালো খাওয়া দাওয়া করা, you get good protein so that you have good eyesight. But you cannot prevent cataract. There is no treatment as such for cataract because it is an aging process. It is not a disease. First of all, we have to realize it is in the aging process. So there is no other prevention method. It will occur for some people যাদের ডায়াবেটিস আছে, সুগার, যা হাইপারটেনশন আছে, বা চোখে চোট লেগেছে বা অন্য কোনো কোমরবিড কন্ডিশন আছে, তাদের ক্ষেত্রে একটু হয়তো আগে আসবে, হাই মায়োপিয়া হলে হয়তো একটু আগে আসবে, কিন্তু আসবে। সুতরাং ওটা নিয়ে টেনশন করার দরকার নেই। যেটা প্রয়োজন সেটা হচ্ছে টু টেক গুড কেয়ার অফ আর আইসাইট, see a eye doctor regularly. That is all.
Yeah, thank you, ma'am. The next question from Ishita Dhar. What is astigmatism?
Thank you, Ishita, for that question. It is also very important because many of us do not understand what is astigmatism, what is a cylinder power correction. Now, when we have to understand when there is a ball and a smooth surface, then the light also reflects on the smooth surface normally. You know, it reflects equally. But when the surface is curved, it is irregular, light also reflects irregularly. So that is astigmatism. The vision there is not only less, but it is distorted. It may not be like a smooth vision. So that is astigmatism. It is sometimes in a particular axis, and that needs to be corrected in the opposite axis or in the same axis, whatever correction you're giving.
Yeah, thank you, ma'am. The next question from Swagata Mukherjee, ma'am. Is glaucoma curable?
Again, very, very interesting question. I've faced it again and again. It is, I am not going to use the term curable, but it is 100% treatable. Glaucoma has to be diagnosed early. You have to understand that glaucoma has to be diagnosed early to prevent blindness, because the sight loss is irreversible, and so you have to treat it. So a person who has certain amount, say 60, 80, 90, whatever percent vision, if it is treated by a glaucoma specialist, will always have that vision throughout the lifetime. Of course, it has to be under observation, regular checkup.
Thank you, ma'am. Ma'am, one question is asked by Poonam Pandey. I am a myopic person since teenage and wearing specs. Since the last 3 years, I am a diabetic patient also. I am 46-year old. Now I have trouble in reading and seeing the objects near me. What to do, ma'am?
Poonam, you are actually in the natural process of aging. Please don't worry because you are myopic. So for 46 years, you have got a grace period of 6 years. Usually a person who is around 40 or 35 plus sometimes has difficulty in near, that is known as presbyopia, chalshe বা চালিশা in Hindi. তার জন্যে আমাদের একটা কাছের পাড়ের চশমা, we need glass spectacles for near, and that is very, very natural. You have got a grace period of 6 years because you're myopic, which normally happens with a myopia patient. but you don't worry. Just go to your eye doctor. একটা progressive পাওয়ারের লেন্স, যেটা শুধু নিয়ার ডিস্টেন্সের নয়, মায়োপিয়ার জন্য তো আপনার ডিস্টেন্স আছে, এবার নিয়ারের জন্য একটা কারেকশন নিয়ে নিন, ইউ উইল বি অল রাইট। আর সিন্স ইউ আর ডায়াবেটিক, I will advise you to go for an eye checkup every 3 to 6 months. Your retina has to be checked up very well.
Yeah, thank you so much, ma'am. The next question from Ashit Banerjee. What is precondition of glaucoma?
Glaucoma preconditions are one of them, as I told you, glaucoma can be genetic. It is very important. Glaucoma can be genetic. There may be a genetic predisposition, or there may be some other, like say in cases of diabetes, there is a predisposition that you'll develop glaucoma. The anatomical features in the eye may be such that you may develop glaucoma. You have to understand that glaucoma is a disease where the pressure inside the eye increases, not for everybody. The same pressure may be different for another and may be different from the other eye. One person may have eye pressure which is normal, and that same eye pressure is more for another person. So glaucoma is something which has some predisposition in the eye. That is the eye anatomy. That is one. Secondly, there may be injury due to which the drainage ways may be blocked, or there is excess secretion for some reason due to which the pressure in the eye increases. I hope that answers your question.
Yeah, thank you. Thank you so much, ma'am. Yeah, the next question from Amlesh Bhattacharya. Kindly state the general precautions to be undertaken in today's computer savvy world from childhood and during adulthood for the working pupil and during old age. And also, please state in the brief, ma'am, what should I do for donation of my eyes after my death?
Thank you, Mr. Bhattacharya, for that kind thought of donation. First, I'll answer your questions. Yes, I have answered in my slides what you should do. Maintain that 20 rule of staying 20 foot away, and then 20 minutes, after 20 minutes, taking a break of 20 seconds. Also, remember to do conscious blinking, because by blinking, we actually lubricate our eyes. And when we stop doing that by staring at the screen, then there is a lot of evaporation and dry eye. So from the childhood, earlier we used to say that it is let the child spend more hours outdoors, but unfortunately for COVID era, we are not saying that. At least give them a break away from the multimedia, and practice more of reading books then picking up more on the mobile and the laptop, maybe games or studies. And thirdly, you can use artificial tears in between, even if you don't have symptoms, to prevent symptoms for coming in for computer vision syndrome. And of course, the illumination part is important. You should not have very bright screen in front of you, which reflects a lot of light in the eye. And taking a break is always important. So these are the features. For eye donation, I would say there are different groups which come in. You can, of course, pledge your eye with the local collection, or you can pledge it with the government bodies who will take your pledge, and maybe you have to inform your family so that they arrange when you actually are eligible to donate it. So there's a government and also NGOs which have this pledging going on, and it is in the web. You can go through it and get these sites. And if you want any specific help from us, you can contact my personal number. I'll give you those contacts.
Thank you so much, ma'am. Poonam Pandey asked one case also. My mother, aged 67 years, she used Travitan from 2011 to 2018. After 2019, it was stopped because everything was all right. What to do next, ma'am?
No, if everything was all right and it was stopped by some doctor, then you don't have to do anything, because sometimes you see, this is very important. The first part of the question is very important because glaucoma is sometimes overdiagnosed. Sometimes it is overdiagnosed because different reasons are there. So nowadays we are very careful. I showed you some tests on the slides like gonioscopy, tonometry, perimetry. So we, before stamping a patient, যতক্ষণ আমরা পেশেন্টটাকে গ্লকোমা পেশেন্ট বলবো তার আগে আমরা অনেকগুলো টেস্ট ওই জন্য করিয়ে নিই, যাতে we are very confident যে পেশেন্টের গ্লকোমা নেই। But sometimes the pressures are so high, we are prompted to give some drugs, কিছুটা ওষুধ দেওয়া হয়, হয়তো সেই জন্য আপনার মাকে আগে ট্রাভাটন দেওয়া হয়েছিল। এখন যদি কোনো ডাক্তার ওটা বন্ধ করে থাকে, মানে he or she has thought best যে ওটা দরকার নেই, সেক্ষেত্রে কিচ্ছু করবেন না, রেগুলার চেক আপ করান। যেটা বেস্ট ইম্পর্টেন্ট ইজ রেগুলার চেক আপ, পেরিমেট্রি আর অপথ্যালমোস্কোপিক এক্সামিনেশন বাই ইয়োর আই ডক্টর। এটা খুব ইম্পর্টেন্ট এবং এটা লাইফ টাইম ওনাকে করে যেতে হবে।
Thank you so much, ma'am. The last question from Ashit Banerjee. My right eye cataract was operated last year. Left eye cataract operation is due for operation. What is minimum time gap for left eye operation? I am over 60 years old, ma'am. Left eye vision is blurred as well.
I understand. As soon as the getting operated, যে চোখটা অপারেশন করা হচ্ছে সেই চোখটাতে যখনই আপনার ডাক্তারবাবু বলবে যে এটা নর্মাল, এখন থেকে আপনি নর্মাল কাজকর্ম করতে পারেন, তারপরে যে কোনো সময় আপনি অন্য চোখটা অপারেশন করাতে পারেন। সেটা 5 দিন 7 দিনও হতে পারে, 5 বছরও হতে পারে, 5 মাসও হতে পারে। এটা ডিপেন্ড করে আপনার চোখের দৃষ্টি কেমন আছে, সেই চোখে ক্যাটরাক্ট কতটা পেকেছে, আর দু চোখ মিলে আপনি কি ধরনের কাজ করছেন। কারণ অনেকের ক্ষেত্রে এক চোখ দিয়ে কাজ করা ডিফিকাল্ট হয়ে যায়। সুতরাং যদি আপনার মনে হয় অন্য চোখটা ভিশন ফল করেছে, একটা চোখ দিয়ে আপনার অসুবিধে হচ্ছে, আমার মনে হয় আপনার ইমিডিয়েটলি আপনার ডাক্তারের সঙ্গে কথা বলে একটা ডিসিশন নিয়ে নেওয়া উচিত।
Thank you so much, ma'am. There are lots of questions are coming again and again, but due to
no
time,
no issues.
yeah.
Just forward them to my mail, and let me tell you that each of your questions will be answered. I will take it in my mail and I will answer them.
And you can give the answer in live chat also, ma'am, in comment section of YouTube channel in which recording
Okay,
is
yes.
going on and in which
Yes,
streaming
yes.
is going on. Okay.
Yes,
Yeah.
I'll do that. And any of you, my number I'll share. You can put it down. You can put a WhatsApp there. And my email ID is Dr. Sudipta Mitra, all in small letters, @gmail.com. You can put it there. Or you can question me at 98302-60283, which is my direct number.
Nice awareness for the patient, ma'am. Thank you so much, ma'am. Have a good day.
Thanks a ton. Thanks. Thank you.